The holidays are supposed to be a time of joy and celebration, but for many people, this time of year can actually bring a lot of mental health challenges. Here are some suggestions we have on how you can reduce stress, and her name is Lynn Moore. She is the CEO of Didi Hirsch Mental Health Services. She joins us now. Good morning, Lynn.
Good morning, Renee. Thank you for having me today.
Yeah, and can you talk a little bit about just really what the state of the mental health crisis is right now, and especially why this time of year, compared to the rest of the year, is really especially difficult for people?
Sure, that's a great question. The state of mental health right now is not great. The pandemic has increased isolation, it has increased people's mental health concerns, depression, and anxiety. And it's a tough time of year for a lot of people. Over 64% of people with mental health concerns express that the holidays exacerbate their symptoms during this time. So it's important to prioritize mental health. It's important to look out for yourself and others and to know that you're not alone. Didi Hirsch provides a lot of resources in the community and help for people during this time.
And what are the most common types of mental health concerns that you normally see this time of year?
Yeah, I would say depression and anxiety are key. Most people are feeling sadness, loneliness, grief, and loss are common during this time. So it's important that you're looking out for those symptoms and also warning signs for people who are experiencing depression. So somebody who is sleeping more or less, somebody who's lacking the ability to concentrate, people who are isolating themselves and not enjoying activities that they usually enjoy, or people expressing suicidal thoughts and ideation. So that's important to note because Didi Hirsch runs the 988 crisis line in California, and it's a place to reach out for help if you're feeling at risk or if you have a loved one that is.
And going on that note, what are some self-care tips that you recommend for people to support their mental health?
Yeah, so self care is really important to prioritize as well because as you build your resiliency, you are able to build your healthy coping skills. And some of those things are eating properly, keeping a routine during this time of year, setting realistic expectations, putting yourself in a position where you are close to loved ones and people who care about you, and avoiding situations that you know can be high stress or create drama, and making sure that you're taking care of yourself, whatever that is. It can be mindfulness exercises, it can be taking a walk, getting outdoors, thinking about something you're grateful for every day, just to center yourself and to make sure you're taking care of your mental health during this critical time.
Now, if we see a loved one who might be struggling, what are some things that we can do to support them?
That's a great question. I'm glad you asked because 80% of people who are struggling with mental health or suicidal thoughts give warning signs. So if you are hearing people who are talking about feeling hopeless, feeling trapped, being a burden to others, or in so much pain that they don't see a reason for living, that's a warning sign. Somebody who is maybe starting to give away possessions, it sounds like they're saying goodbye to someone. Increased substance use is another sign. So make sure that if you see any of these signs, you ask somebody, ask them directly, and you can say it in a way that you care. Just say, look, I'm noticing that you're sounding hopeless and that you've been using more alcohol lately. I'm really concerned about you. Are you thinking about suicide? And if that's hard for you to do, call 988. We have trained counselors on the line that can help guide you through helping somebody who may be at risk for suicide.
All right, all good tips. That's Lynn Moore, CEO of Didi Hirsch Mental Health Services. Thank you so much for joining us, Lynn.
Thank you so much for having me and addressing this important topic.
We will be right back. Stay with us.